Story number 1, Hatchery 6. I arrived at Clearwater Springs Hatchery at 9:30 in the morning on a Tuesday in late October. The drive from Spokane took 2 hours through dry grassland that was already turning brown. I had been assigned to this facility for quarterly water quality inspections for 3 years, and the route had become automatic. The hatchery sat in a narrow valley where the Clearwater River bent north, surrounded by stands of ponderosa pine and the kind of silence that comes from being far enough from any town to matter. The manager, a man named Hendricks I had worked with since my first visit, met me at the main office. He looked tired. I noted that immediately because he usually maintained the professional bearing of someone who had run the same operation for a long time. He told me that several staff members had called in sick over the past week, which was unusual for October. He also mentioned that fish mortality rates in the holding tanks had increased, though he said the cause was unclear. He asked if I could prioritize tank 7 during my inspection. I said I would follow standard protocol. The hatchery consisted of 12 concrete holding tanks arranged in 2 rows, each one approximately 30 feet long and 8 feet deep. The water came from a spring-fed system that maintained consistent temperature and mineral content. I had tested this water dozens of times. The parameters were reliable. During my initial walkthrough, I noticed that Tank 7 appeared darker than the others. The water in the other tanks was clear enough to see the salmon schooling in their usual patterns near the bottom. Tank 7 was opaque. The water had a quality I can only describe as depth, as though the tank was deeper than its marked 8 feet. I took out my portable turbidity meter and tested the sample. The reading was normal. I recorded it in my field notebook and moved on to the other tanks. The morning proceeded according to schedule. Tanks 1 through 6 showed expected parameters. Temperature was consistent. Dissolved oxygen levels were adequate. pH was stable. I collected samples from each tank in sterile containers and sealed them for transport to the regional lab. By 11 o'clock, I had completed 9 tanks and was ready to move to Tank 7. When I approached Tank 7 with my collection kit, I noticed the water temperature first. The surface felt noticeably colder than my probe indicated. The probe read 54 degrees Fahrenheit, which was correct for the season. But when I submerged my hand, the temperature dropped noticeably below that. I withdrew my hand and tested again. The probe registered the same temperature. I noted this discrepancy in my field notebook. I then observed the fish. In the other tanks, the juvenile salmon moved in loose schools, rising and falling in the water column in response to feeding times and light. In Tank 7, the fish were suspended. I counted approximately 24 salmon arranged in a pattern that I could not immediately explain. They were not schooling. They were not resting on the bottom. They were positioned at mid-depth in what appeared to be a geometric formation, equidistant from one another, oriented in the same direction. I watched them for several minutes. They did not move. I attempted to follow protocol by requesting that Hendricks authorize a tank drainage and full inspection. I explained the anomalies I had observed. He refused. He told me that corporate had issued a directive 2 days prior that forbade any disruption to Tank 7 operations. He said the directive came from regional administration and that he did not have authority to override it. I asked to see the directive. He said it was not available for field personnel review. I told him I would note the refusal in my report. During the lunch break, I returned to Tank 7 alone. The hatchery had a small break room where Hendricks and the remaining staff were eating. I walked to the tank with the intention of collecting a specimen despite the refusal. I wanted to examine one of the fish directly. I reached into the water with a collection net. The moment the net touched the surface, I felt resistance. Something pulled downward from below the surface with enough force that I could not hold the net. The resistance increased, and I was pulled forward, my arm submerging to the shoulder before I could release the net and step back. The water was cold. Colder than the probe had indicated. I withdrew my arm and stepped away from the tank. The net was gone. I did not see it surface. I did not see it sink. It was simply no longer there. I returned to the break room and did not mention the incident to Hendricks or the staff. I finished my lunch and completed my remaining paperwork. I collected the sample containers and prepared to leave. Before departing, I filed my report as inconclusive pending follow-up inspection and submitted a formal request for facility suspension pending further investigation. I noted all discrepancies and the refusal to allow tank drainage. I submitted the request to regional administration before I left the property. The request was denied within 4 hours. I received the denial notification on my phone as I was driving back to Spokane. 3 days later, I was notified that Clearwater Springs Hatchery had been reclassified to restricted access status. All quarterly inspections were suspended. My assignment to the facility was transferred to a different jurisdiction without explanation or notification of the new inspector's identity. I was instructed to submit all field notes and sample data to the regional office for archival processing. A week after that, I received a letter of commendation for procedural compliance and professional conduct during my tenure at the facility. The letter was unsigned. It thanked me for my service and informed me that all documentation related to Clearwater Springs, including my field notes, sample analysis, and incident reports, had been moved to archival storage under administrative seal. The letter stated that no further inquiry regarding the facility would be entertained. I have not returned to that location. I have not been assigned to any facility within 50 miles of it. I have not been asked about Tank 7. The incident is closed. The file is sealed. I am reassigned. Story number 2, Specimen 47B. I arrived at the University Medical Research Building at 8:30 in the morning on a Tuesday in March. The day was overcast, and the parking lot was already full with the usual mix of faculty vehicles and student cars. I had conducted this annual biosafety audit for 6 years running, and the routine had become automatic enough that I could move through the checklist without much thought. My assignment was straightforward: verify containment protocols, review documentation, test alarm systems, and sign off on the Level 3 facilities on the 4th floor. Dr. Rise met me in the main corridor, outside the elevator bank. She was in her early 50s, competent, and I had always found her cooperative during previous audits. She mentioned almost immediately that one of her postdoctoral researchers had not reported for work in 3 days. The absence was unusual but not unprecedented, she said, particularly during grant deadline periods when people sometimes worked irregular hours or took sudden time off without proper notice. She seemed unconcerned about it, though she had filed a welfare check request with campus security as a precaution. I made a note of the name and continued with the inspection. Laboratory 4C was the primary focus of the audit. The space was organized according to standard protocol: biosafety cabinets along the western wall, cold storage units in the northern corner, a dedicated prep room with separate ventilation. I began with the equipment logs. The cold storage unit showed a temperature fluctuation event 48 hours prior. The reading had spiked to approximately 42 degrees Fahrenheit for roughly 90 minutes before returning to the correct range of negative 80 degrees. The biological samples inside appeared undisturbed and properly sealed in their original containers. No alarm had been triggered. The log entry was dated but unsigned, which I flagged for Dr. Reyes to address. I moved into the adjacent prep room to review the waste disposal records. The documentation was current and properly filed. It was while I was cross-referencing the chemical inventory with the disposal manifest that I heard the sound. It was rhythmic, deliberate tapping, coming from inside the walk-in incubator unit mounted in the wall between the prep room and the main laboratory. According to the equipment schedule pinned to the door, the incubator should have been empty. Maintenance had performed a cleaning cycle the previous week, and no experiments were currently using the unit. I opened the incubator door. The researcher was sitting on the floor in the center of the chamber, her legs crossed, her back upright. Her name was Sarah Chen. She was unresponsive to my voice, but her breathing was regular and her pulse was steady when I checked her wrist. She was not cold, which was the first unusual detail. The incubator had been running at 37 degrees Celsius, but her skin temperature was normal, perhaps even slightly elevated. Arranged around her in concentric circles were approximately 200 Petri dishes. I counted them as I photographed the scene. The dishes were not labeled. They contained no visible growth media, no agar, no broth. Instead, each dish held a thin layer of clear fluid that I did not immediately recognize. The fluid was not water. It had a faint viscosity and a quality I can only describe as reflective, though there was nothing to reflect in the incubator's interior. I checked the laboratory notebooks immediately. The past 72 hours contained no experiment entries, no protocols, no observations, no data. The last entry in Chen's handwriting was dated 3 days prior and read-only, beginning the count, with no further notation. I called campus police and emergency medical services from the corridor outside the laboratory. While waiting for them to arrive, I sealed the laboratory using the manual override system and notified Dr. Reyes that the audit was suspended pending investigation. She did not ask questions. She simply nodded and asked me to keep her informed. Emergency medical services arrived within 8 minutes. The paramedics examined Chen and found nothing acutely wrong with her. Her vitals were stable. Her pupils responded normally. They prepared to transport her to the university hospital. As they were moving her onto the stretcher, her eyes opened once, fully and suddenly, and she spoke clearly. "They are counting themselves." Then her eyes closed again, and she did not wake during the transport. I remained in the laboratory with the dishes. I did not touch them. I photographed each concentric ring from multiple angles. The clear fluid in each dish was identical. There was no variation, no cloudiness, no sign of bacterial growth or contamination. The dishes themselves were standard sterile Petri dishes, the kind used in any undergraduate microbiology course. At 4:45 in the afternoon, a specialized response team arrived from the state health department. They wore full protective equipment and carried equipment I was not cleared to identify. The team leader, a woman whose name I did not catch, instructed me to remain in the corridor while they worked. I could see through the laboratory window as they photographed the arrangement, then carefully placed each dish into a sealed transport container. The process took 3 hours. They did not explain what they were doing or what they suspected the fluid might be. I remained on site for 16 hours total. During that time, the laboratory was sealed and marked for decontamination. I was not permitted to re-enter. Dr. Reyes was informed that the facility would require a complete environmental remediation, and she accepted an immediate sabbatical to a research station in Alaska. She left the university within 48 hours. The researcher, Sarah Chen, was transferred to a facility outside the normal hospital network. I was told she had regained consciousness, but was being kept under observation. I was not given further updates. My audit report was filed as incomplete due to equipment contamination and ongoing investigation. The building's fourth floor was permanently reassigned to administrative offices. The laboratory spaces were gutted and converted to conference rooms and storage. The cold storage units were removed and destroyed. I now conduct all university inspections with a partner present at all times. This is standard protocol now for facilities that have experienced biological incidents, though the incident itself is not discussed in any official capacity. The case was closed and archived on June 15th of that year, filed under a classification I am not permitted to reference in writing. Story number 3, Vector Control. I was dispatched to Palmetto Grove Mobile Home Park on a routine vector control assessment following 3 reported cases of West Nile virus in residents over 65. The cases had emerged within a 10-day window in late August, all clustered in the western quadrant of the park, near the retention pond. I had been conducting these investigations for 12 years with the Department of Health, and the pattern was familiar enough. Mosquitoes, standing water, seasonal uptick. I arrived on a Tuesday morning with my collection kit, pH meter, and standard documentation forms. The park manager, a man named Gerald, walked me to the pond. He mentioned that all 3 patients had complained of unusual insect activity near the retention pond before falling ill, but he attributed it to the summer heat. He seemed eager to move past the subject. I noted his reluctance but did not press. My job was to assess breeding habitat, not interview residents. The pond itself was roughly 40 meters across, bordered by palmettos and Australian pines. The water level was low from the dry season. Typical breeding ground. I spent 2 hours collecting larval samples from the margins and deeper sections. I filled 4 vials with water and sediment, sealed them, and labeled them per protocol. Back at my field station in the truck, I examined the samples under my portable microscope. The larvae were present in expected numbers, but their behavior was not standard. They clustered together in tight formations, moving in synchronized patterns rather than the dispersed, individual feeding behavior I had documented thousands of times. I recorded this observation and flagged the samples for laboratory analysis. The clustering could indicate a response to chemical stress or contamination. I collected water chemistry data. pH was neutral. Dissolved oxygen was adequate. No obvious toxins. I filed my initial report and recommended a second site visit within 48 hours. The laboratory results would take 3 to 5 days. I returned on Thursday morning. The weather had been clear and warm. Conditions for mosquito emergence were optimal. I expected to observe adult populations at dusk, but when I arrived at the pond, I noticed something immediately. The surface was covered with a thin film, perhaps 2 millimeters thick, extending across roughly 70% of the water. It was not algae. It was not petroleum-based. It was translucent, faintly iridescent, and it did not disperse when I disturbed the water with a sampling pole. More notably, I observed no adult mosquitoes in the vicinity. No emergence activity, no feeding activity. The breeding conditions remained ideal, but the adult population was absent. I collected samples of the film in sterile containers. I took photographs. I measured the pH of the water beneath the film, still neutral. I documented the observation and submitted it for analysis. I noted that the film resembled no known algal bloom or bacterial mat in my experience. I did not speculate beyond that. The laboratory called me on Friday. The larval samples showed no signs of parasitic infection or bacterial disease. The clustering behavior remained unexplained. The film samples had not yet been processed. I was instructed to conduct a dusk observation to assess adult emergence activity. I arrived at the pond at 6:45 in the evening. The sun was low. The temperature was dropping. These were conditions that typically triggered emergence. I set up my observation station with a net and a headlamp. I waited. At 7:20, the film began to move. It did not drift. It did not respond to wind. The wind was coming from the northeast. The film moved against it, shifting and reforming in coordinated patterns. The movements were slow, deliberate, and geometric. Squares, circles, spirals. I watched for 8 minutes. The film continued its patterns. I did not see any adult mosquitoes. I did not see any visible source of propulsion. The film simply moved as though it were alive and directed by intention. I documented what I observed in my field notes. I used precise language. I described the movements as coordinated and geometric. I noted the absence of visible mechanism. I did not use words like intelligent or purposeful. I recorded times and measurements. I took photographs, though the light was poor and the images were unclear. At 7:32, the film stopped moving. It settled into a smooth, undisturbed surface. The sun had fully set. I waited another 30 minutes, no emergence, no activity. I packed my equipment and left. On Saturday morning, I received a call from my supervisor, Dr. Patricia Reeves. She asked me to come to the office. She did not ask about my observations. She asked me to bring my field notes and all samples and documentation from the Palmetto Grove investigation. I complied. In her office, she reviewed my reports without comment. She read my observation notes twice. She did not ask questions. She opened a drawer and removed a form I had never seen before. It was marked with a classification I did not recognize. She asked me to sign it. I asked what it was. She said it was a containment order. I asked what I was containing. She said the investigation was being closed and reassigned to another department. She said my role in the matter was concluded. She said, I should not return to Palmetto Grove Mobile Home Park and should not discuss the investigation with colleagues or external parties. I signed the form. I surrendered my samples and documentation. Dr. Reeves placed everything in a sealed envelope and locked it in a cabinet. She told me I would be reassigned to routine surveillance work in the Northern District. I accepted the reassignment. The 3 residents who had contracted West Nile virus recovered. No additional cases were reported in the park. The retention pond was not drained. No public health advisory was issued. I have not returned to Palmetto Grove. I do not know what happened to the film or what the laboratory analysis revealed. The investigation was closed on August 29th, 2024. It remains archived under restricted classification. I continue my work in vector control. I file my reports. I follow protocol. I do not discuss Palmetto Grove.